Well, that was a fantastic session. Thank you to all three of the speakers for really engaging us in some really thoughtful ideas. I wanted to just start by commenting on one thing. I think, as a pediatric oncologist and somebody who spends most of their time in a research institution, I was really taken by some of the. I think a common theme for all three of the speakers was the importance of giving members of the community agency, and that communication isn't just about us doing a better job of communicating facts about science, but it's about giving um, members of the community agency to understand the environment that they're living in, and provide them with tools to impact on that environment. So thank you for that. I wanted to start out with a question, again, from my point of view as a pediatric oncologist. Most of what you talked about, except for what Trevor commented, but Dr. Brody and also Dr. Ramirez Andreotta was focused on adult exposures, and which is of course very important. But one thing that comes up very frequently in my experience with families who have just had a child diagnosis, there's a huge amount of guilt oftentimes, and there's a huge amount of search for what they could have personally done wrong. And so I think I was also impressed by what Dr. Brody said around the importance of not saying, oh, there's no proof. But I'd say I'm guilty of that myself, because we're trying to assuage people's guilt. So we say, oh, don't worry, you didn't do anything wrong. There's no proof that anything you ate could have done this. So how do we kind of get over that and sort of move beyond to perhaps a more constructive conversation with families? Maybe I can start with that question.
Well, I guess I'll jump in. First of all, to point out that some of the examples that I showed are in pregnancy cohorts. So they're, as was discussed earlier today, these are exposures that are relevant to children. I think that I hope that others will speak to this as well, but in our experience, people want very straightforward communications, and that doesn't have to involve generating guilt. You can be quite straightforward about what you know, and people appreciate that kind of honesty.
I would chime in and say that, interestingly, like in a community meeting, right, and where there had been these elevated levels of arsenic in the drinking water, and this was due to, potentially due to the contamination, but also naturally occurring arsenic in this region of Arizona. And this is where, in a community meeting, you had, a community member stand up and say, and who was, just was pregnant, and acknowledging that they felt they had moved from California to this rural part of Arizona where they thought they were getting this pristine water, like this perception of like, I'll have a private well and it'll be this high quality because I'm moving away from an urban space into this rural space. And they stood up and said, have I just come? So they're saying, like, I drank this water through my whole pregnancy with my child with an elevated a level, arsenic concentration above the current drinking water standard. And this was where, they're saying, what do I do? And they started, they're very upset, right? Crying in the public meeting. And I think that, the way at that point I was a little young in the game and I was witnessing this. And the first thing I saw happen was like, somebody just went up and acknowledged this, like empathetically acknowledged this pain, like hugged the individual to say, we completely understand why you would be feeling this way. And then they continued on to be very direct, right? It's like, here's what we know about here's the state of toxicology around like exposure in the gestation period, right? You cannot take on this, you don't like go into the blame side. Like, let me tell you like what we know about this currently. And I think that it was that openness and direct demonstrating empathy, being transparent and direct, really was something that helped to take that person off that path of blame.
Thank you for that. Trevor, do you have anything you'd like to add to that?
Well, yeah, I would like to add on to that. Those were some excellent points. And I think it was a similar experience in my town where I was diagnosed with cancer, where we moved when I was 6 years old. It was a vacation home originally, and we moved full time when I was 6. And my mother kind of shared that guilt of, did I move my son into an area where I exposed him to these issues, because it was on a glacial body of water, looked pristine. And it's not up to the community, nor do I think it's expected of the community to know what skeletons are in the closet, so to speak. And that was the issue, certainly where I grew up. So it's definitely important for the community and impacted families, both of childhood and adult cancers, not to feel guilty or blame, because they're issues that are oftentimes hidden purposely, a lot of times, unfortunately, that the community is not aware of, and it's not their job to know those. And no matter how much research they might do about an area they're moving to, some of those issues are hidden so well that they might not be able to uncover them.
I'd like to add that in our experience at Silent Spring Institute, people who've been affected by cancer want to contribute from their experience to a better future. And by being transparent about the potential causes and trying to understand them and remediate environmental factors, it gives them an opportunity, in spite of their sadness, to contribute to the future. And that's something that can be very meaningful and helpful.
Yeah, that's a great point. And just to follow up on a more specific question for you, Dr. Brody, you mentioned this really interesting app that you developed, this Derby app, and maybe you could just tell us a little bit more about how data gets into that app. It wasn't entirely clear to me what information participants are provided that is uploaded into this app. Can you say a little bit more about that?
So far, it's been used to report back individual environmental exposure data to people who've been in a study. So they've contributed biological or environmental samples, and the research team then uploads the data set into Derby, which is a platform that then generates headlines that summarize key findings for an individual and also provide contextual information. Great.
So I guess that leads me to the next question, which is, we're accumulating more data from these various really exciting research projects that you described, both Dr. Ramirez Andreotta and Dr. Brody. How do we deal with the issue of lack of data interoperability, or how do we build an ecosystem on a larger scale that allows, empowers people to access that data and think about it, both on the researchers side, but also on the community activist side, through environmental agencies like the CDC and the EPA and other agencies like that. Do you have anything to say on that point?
Well, there's a lot of opportunity there to create resources that could be accessible to the public. NHANES, of course, is already accessible and widely used by researchers, providing information about what typical exposures are and allowing for evaluation of subgroups by demographics and other characteristics. So that provides a framework that we use quite often to help people understand whether their exposures are typical or atypical. Typical doesn't necessarily mean okay. So we don't want to normalize having harmful chemicals in our bodies, which is common. But these types of data do provide a framework for assessing what might be an outlier, and that is very helpful. The National Institutes of Health now is creating large multi-site studies that will have shared data sets as well. And All of Us study is another example.
Yeah, and I would highlight that the question about standardization and interoperability. I mean, one thing we could acknowledge, right, that there's not like state and federal data sets aren't necessarily interoperable, and that's a challenge in itself. But the other thing is thinking about when you're doing community science work, people are heavily motivated. They're taking the time to do their own environment, to participate in a study, do environmental monitoring, learn how to sample, learn how to interpret data sets. And then their data, that data set, right, generated by the community can sometimes be like overlooked and not acknowledged. And so in 2021, 2021, I worked with a set of data scientists where we published a paper called Alleviating Environmental Health Disparities Through Community Science and Data Integration. And the whole purpose of the paper was to say, number one, community members have contributed to a data set, and this data set needs to be interoperable and accepted, right? They're biased towards this data, right? There's like so many papers acknowledging, right, the rigor and that we can be using this community collected data, environmental monitoring data I'm specifically referring to here. And so the idea here was like, how do you get this community science data to be interoperable, to one, be, used, but then it's used within the study, right? And to report back to for communities and for that site specific study. But how can we ensure that this data set also gets incorporated and is interoperable with state and federal data sets? And so in this work, we developed, in this case, like an ontology called the Superfund Research Project Data Interface Ontology, where we integrated environmental monitoring and social attribute data that spans across 10 different state and federal data sets with the Garden Roots data set. And so this was a methodology paper to highlight, right, that we need to be acknowledging and integrating this data. So I'm just speaking from, I guess, more of the data science side of things.
Thanks. So we have some questions here from the audience, so I want to get to those before we run out of time. So the first one from Wei Ting Huang, would the data reporting back process or content, would it depend on whether the community is part of a research study or not? I am also curious as to how best to communicate the level of evidence or statistical uncertainty of the associations or risk using those reporting tools. Do anybody want to tackle that one?
I think the beginning part of the question was, is reporting back limited to people who are in the study? And I would say the answer to that is no, that individuals will get their own results, but community members who are not in the study, as well as those who were in the study, will get study-wide results that are relevant to their community. So it's important that community members also learn from the study-wide results for those data.
Okay. Dr. Ramirez, anything you'd like to add there?
Nope. Yeah, I mean, you should be reporting back as much as you possibly can, right? This is going to the heart of science communication. Best to communicate level of evidence or statistical uncertainty of the associations. I mean, this is again going back to, to me, it was like unveiling a lot about this, like here you're living near a contaminated site. The way that this person gets, the way that the cleanup, the decisions around the cleanup that will be made here are going to be based on an assessment process, right? And the risk assessment process will do this exposure assessment based on these variables. And so the thing in these communities is like raising the capacity to understand the risk assessment process, to be able to then comment and inform cleanups. In addition, that these also lead to the permitting, environmental permits, right? These risk assessment processes. And so that's one thing that I find important in working with communities neighboring resource extraction and or these state and federal Superfund sites, is that they have all the tools to then to understand how decisions are being made around cleanup. And that helps out a lot. And when you talk about, so you have statistical uncertainty, you can imagine in one of the graphics I showed, it's like there's a high level, there's so many assumptions that go into these exposure assessment models. So it's really important to describe those so that people feel confident in questioning and asking and improving how risk assessment is occurring within their space, with an understanding that these are, flawed models in some case. We could, well, that's a whole nother conference though, right? Of talking about the risk model.
So Trevor, I have a question for you. So I think we heard some really interesting data from Dr. Ramirez Andriota about how informing people about one issue in terms of environmental exposure can increase their ability to interpret data for something else like COVID, which I thought was really interesting. And I'm curious, in your experience as a activist and a director of an organization that seeks to improve communication and agency for patients or families who have suffered from cancer. How do you see this issue of sort of increasing, or how do you work with families to increase their level of understanding of kind of statistics and as Dr. Ramirez showed us, these even interpreting something as something we think of as very simple, like a bar graph that for your average person it may be completely foreign. How do you think about that issue?
Yeah, well, I think it's a very good point that we have to be very careful not to present information in a way that goes over the community's heads, because there's a level of where the scientific aspect certainly can get a little confusing for some people, especially me being able to speak on that because I'm more of one of those common people who might not understand some details to a certain degree. So we definitely have to be conscious of what level we present that data to. But in our experience in communicating with communities, it's certainly more at the community level, not the professional level within the community of the people actually experiencing the illnesses, them finding us more so. And that's the whole purpose of why we started our program, to try to identify childhood cancer clusters. So we have some data to go off of to reach out to those communities, because that's another issue, that they might not have the means or think of ways to be able to reach out to us or other individuals about issues in their community. And they might need help to know where the resources are and where they can go to share that data, to get assistance, and to get that ball rolling. So I don't think that the mechanisms are in place to be able to provide that avenue for communities to be able to share their data, or to be able to know where to go to share that data or to get answers. So we definitely need to, and going back to what I said earlier too, is about providing a simple way that we can connect the community and experts, scientists and health experts to so they can communicate and be able to easily provide a line for them to be able to share that data.
Great, thank you. So going back to the chat here, we have a comment and a question from Shaban Lash. Hope I didn't mispronounce that name. As an environmental ethicist, I regularly see politicians cite remarks of false reassurance from the CDC or other agencies as a way to downplay overburdened communities experiencing higher incidence of health ailments connected to exposure to industrial pollutants. Unfortunately, I have seen firsthand the condescending way experts treat directly impacted communities that are worried about their children's risk, similarly to how Trevor and his mother were treated. However, I have also seen how data sharing and increased engagement can improve political, economic, and environmental justice outcomes, but this is usually due to access to proactive NGOs. So that's the comment. So the question is, how can these overburdened communities with limited resources and who deal with information asymmetry gain access and know to access such resources like Derby or other or other resources that can help bolster their aim for environmental equity? Is there outreach, like being part of a lunch and learn hosted by NGOs? Any comments on that point? I think, again, the overarching theme of increasing agency for communities to participate actively in information gathering.
Yes, I'll jump in there because I do think that new CDC policies should have resources that go to communities that enable them to participate fully in the investigations. They do need to be resourced to be able to participate, and that should be a responsibility to provide those resources in a community cancer investigation.
Can you specifically comment? I'm jumping down to the bottom, but there's a question, Dr. Brody, since we're on this topic. Is Derby a publicly available tool that researchers can apply to their own studies?
PFAS Exchange, which is specifically information about the PFAS chemicals, is publicly available. You can access it online, and you can enter drinking water data from anywhere and get graphs of results in comparison to various drinking water standards. Or if you have biological results for yourself, you could enter those. Derby is available to teams that partner with us, and I would welcome anyone to contact me about whether that might be a possibility.
Great, thank you. So going back to the question and the comment from the community member, any other responses?
So I was going to highlight that in the community science projects that I've been leading and doing, like these are co-led, I should say, like co-led, right? So one Project Harvest had worked with an NGO, and one of the major, so that's, for example, another, like Garden Roots is working with like coalitions around different areas, and so that partnership is critical. And so I would, advocate and highlight that to others thinking about their work and projects of partnering with NGOs. The other thing is looking at what, we call them knowledge liaisons, knowledge mediators, promotoras, like these community health workers. And so in Project Harvest, as well as in other projects coming out, is hiring, right, these knowledge liaisons, promotoras, right? So these are individuals who are embedded or live within the community in which you're working with and partnering with. And so that you train, they either essentially, you can, depending on what the project is, you can train them up and they can train others. But that role, this promotora, is incredibly helpful to address, right, and be the linkage and liaison to help with communication, to help with outreach, and to essentially connect and create the network around the project and other areas. So one big example is that they can, not only are they trusted because they're from the community which you're partnering with, but then they can also be somebody to help refer and connect community members to other resources that might be available in their community or at the state and federal level. And so I just want to acknowledge the comment is 100% well taken. And I'm in full, agree that the partnerships with NGO has been incredibly helpful. And I would highlight the roles of these community champions, community leaders, or what we've been calling promotoras, these community health workers in these spaces.
Great. Thank you, Dr. Ramirez. Thank you, Dr. Ramirez. So Dr. Plon has a comment. Interestingly, as a cancer geneticist, we often find that people attribute pediatric cancer to environmental exposures and are surprised to learn that it may be genetic, which I think is a really interesting point. Ties in with a provocative comment that Dr. Ramirez made that zip code may be more important than your genetics, which I think, I think is really interesting to think about. So I wonder if we could maybe have a little bit of a conversation about how those two may, how to think about those two, or how to help communities think about those two elements, particularly when we're thinking about pediatric cancer risk. Obviously, I think there's compelling evidence that both are important. And I think we've heard very compelling evidence that, empowering communities to think about environmental risk is really a critical need. Can we also empower them to think about how to think about their own genetics and how the genetics and the environment may contribute together? We heard some interesting information on that point from Dr. Weemels as well. So I just wanted to put that out there.
Well, certainly there's been a great proliferation of information about the role of genetics, and there are genetic counselors who address this with patients. But remember that one of the core themes of the day is that childhood cancers are increasing, and that can't be due to genes because they haven't been changing that rapidly. I think the theme of the workshop has been that environment does play an important role that we don't understand very well yet, and that it interplays with genetics. But so far, we've devoted a great deal more resources to unfolding the genetics than the environment side of that equation.
Yeah, I think that's a fair point for sure. Trevor, anything you'd like to add?
Yeah, I certainly think that's a valid point that genetics certainly play a role, but I definitely believe that environmental factors trigger genetics. Genetics alone, in my belief, do not cause cancer. I do believe that there are factors that that contribute to that, environmental factors specifically. So that's why we had a focus, and we've been since the very beginning talking about childhood cancer specifically because like Dr. Brody mentioned, I mean, children are essentially canaries in the coal mine. They alert you when there's an issue because they're young, so they don't drink, they don't smoke, they don't hold stressful jobs. Their immune systems are still developing, so they're a lot more susceptible to what is in their surroundings. So that plays a big role, and our children certainly alert us of issues that are in our environment.
Great, thank you, Trevor, for that. There's a comment in the question here from Agnes Reynolds, who's a nurse in Hartford Hospital, which I think relates back to the point of agency for individuals. I'm trying to impact education for our women's health at Hartford Hospital. Would love to connect outside of this excellent workshop. I have been involved with Phelan leukemia cluster. One child from that true cancer cluster will be having a baby soon. Is there a way for people who are interested in donating samples? This is a specific question. I'm not sure who could best answer this. Who are interested in sort of, I guess you could say, community research. How can they donate samples for research to kind of look into these clusters? Is there a mechanism to do that you're familiar with?
I'm not aware of anything like that.
Okay. Well, I had one final question that I wanted to ask. We've heard a lot about sort of environmental exposure, but I think one thing that hasn't been touched on is people move around. And so Dr. Ramirez, you live on the border. Obviously, I'm sure this is something you think about a lot. Somebody could have been exposed to something, in one part of the U.S., and then that exposure went away. You no longer detect it, but it's still there and it's still affecting them. Or maybe they were exposed to something when they were living in Mexico, and then they moved to Arizona, and that exposure is no longer in their body, but it's impacting their risk. Can one of you comment a little bit about, is there research looking at that? Is that something we should be paying more attention to? Just something that occurred to me.
I mean, I think that again, being transparent and acknowledging all of these factors and doing, we do these rigorous environmental monitoring studies, rigorous biomonitoring studies, but we also need the rigorous social science studies, right? Understanding the lived experiences of these individuals to capture exactly what you're talking about, right? And so that's why I was highlighting a mixed methods approach, right? So you can be gathering this type of social and lived experience in conjunction with your environmental and biomonitoring data to truly create the social ecological landscape of the individual to understand the question at hand or to inform future work. I also want to acknowledge that these individuals that we're engaging, right? It's not like it, you know, the thing that so I approach all of this report back and data sharing from an informal science learning perspective, right? If we think about adults and people are and understanding kids, but people are learning science and more science as adults in informal settings, right? They are they are learning based on what they're interested and motivated by, and that these individuals have a lot to contribute to the process. And so types of questions that are being asked today are really good questions to ask your partnering community members, right? And the partnering, participants in your studies, because they'll have great insight into, right, their experiences because they're experts in their own right by living in that space and bearing witness, right, to the scenarios that we need to be aware of. And so I just want to acknowledge, so that's how I would answer your question, has been like, yeah, you can definitely, again, create a social ecological landscape, social, health ecological landscape of understanding that includes asking questions about the lived experience. And then also treat your partnering community members as experts in their own right and have them making decisions at the table with you.
Fantastic. Well, I think that's maybe a great way to end this session. So thank you all for this excellent and really enriching presentation. And so now we're going to move on to, I think, what is the last session in this really great workshop, which is I think there's going to be a little bit of a break, and then the last session will be lessons learned and future considerations, which will be moderated by Roberta Nest. Thank you.